Recording has started.
There we go. Okay, well, welcome to the MCOH online training, Stepping into the Future, Innovation through Teledentistry, Part 1. Part 2 will be next Friday from 2 to 4 p.m. Watch for a reminder from CE Zoom with the link for Part 2. That'll come out approximately 24 hours prior to the event, and please note it is a different link than the link that we had available for today. I'm Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health, and again, I'm just delighted to have you all here, not only because it's an important topic, but because I'm happy to have some interaction with human beings during this strange time. I want to note the CEUs are being provided through CE Zoom, and there'll be a code at the end of today's session that you'll need for that. And I do want to note, because it's recorded, that CEUs are only available to those attending the sessions live. Watching the recorded session won't do anything for you. You should have received a pre-session survey link by email. Thank you for those of you who completed the survey. There will be another link sent out after Part 2 for a post-session survey. These are things that the coalition does so that we can track the impact of the training and do quality improvement. So they're very important to us. And there's also a separate survey that you'll get related to CEUs directly from CE Zoom. I want to be sure to thank the Missouri Office of Dental Health for sponsoring this online training, and to Access Teledentistry for partnering with us for it. And thanks also to the Missouri Office of Dental Health and the Missouri Foundation for Health for supporting the registration raffle. And congratulations to all attendees who received a mouthwash intraoral camera system. We were just delighted to be able to do that, and we hope they get good use. The coalition has long supported the development of teledentistry in the state, and we continue to do that because it is a way to increase access to the many underserved areas and individuals throughout the state. And we hope that each and every one of you find a good adaptive way to use teledentistry. This is one of those unusual times where Missouri is actually on the cutting edge of something rather than being 20 years behind. And we hope you get a lot out of this training and feel that you're able to go out there and start using teledentistry. I'm going to provide just brief introductions to our two presenters, although I understand only Dr. Suter will be presenting today. But real brief introductions, you can see their full bios if you go to the Access Teledentistry website. So that's www.accessteledentistry.com. Nathan Suter, DDS, is the chair of the board of the Missouri Coalition for Oral Health. He served on the board since 2014 and also chairs a conference committee. He is the chief executive officer of Access Teledentistry, a company he started with Tiffany Grant. He is the former dental director with Comtree Comprehensive Health Center, a federally qualified health center. And he advocated for the establishment of teledentistry in Missouri and started the first teledentistry program in the state. He's a graduate of the University of Missouri, Kansas City, UMKC School of Dentistry, and there's many other great things to say about him, but I'll let you read his complete bio, including some of the awards he's gotten. Tiffany Grant, BS RDH, is the Chief Operations Officer of Access Teledentistry. She has a 16-year dental career as an assistant hygienist and dental educator. Served in the United States.
Recording has started.
Looks like we had a glitch on the recording, but it started again. She served in the United States Air Force and worked as a dental educator and community oral health director, where she successfully created and implemented several prevention-based initiatives and programs. Tiffany worked for Comtree in Jefferson County, Missouri, where she was an integral part in implementing oral health and primary care integration initiative and the teledentistry outreach pilot. So that is the end of the introductions. With that, I'm going to turn it over to Dr. Suter.
Thanks a lot, Greg. I'll start sharing my screen now. Great. Okay. So, again, it's a great, I'm very grateful to be able to present to you today and next week. So, just a little bit about what we're going to be doing here is we've got we normally have our last time we did this, it was a 2 half-day sessions in person where we got to do some hands-on training and things like that. So what we are going to be doing for the virtual concept of this is we're going to break it up into two days, and the first day today is going to be myself presenting. And if you don't have it muted, if someone could mute that, that'd be wonderful.
Recording is on.
A couple people that just need to mute, so I might remind you guys as we go through. But today what we're going to go over is 2 sections, okay? I'm going to give you just an introduction to teledentistry in general. That's what we're going to start off with for the first half of the workshop. An overview of different use cases that are going around in the country. And then the second thing that we're going to do is we're going to go into some applications of teledentistry. So actual ways you would use it and consider using it in your practice. With that, I'll get started here. And the other housekeeping piece that I wanted to say was I'm going to try to incorporate your guys' comments and feedback. So if at all you, I'm going to find some times here to maybe ask you guys to put some stuff in to the chat box and maybe take a break and have a little thing where you can ask me some questions and then we can answer them so that you don't have to sit here and just listen to me talk for 2 hours. So we're going to see how that part goes because that's always fun. All right. So just some disclosures. I am a private practice dentist. I have a contract with the Department of Health and Senior Services who's putting on this program today with a grant that we have going on. I also work for the Arcora Foundation, which is a part of Delta Dental Washington. I'm on the board of Enable Dental Group, which is a portable nursing home DSO. Also, I'm a mouthwash advisor for mouthwash. I consult with multiple providers. I'm also newly a co-founder of Helier, which is a care coordination platform that I can show you a couple of screenshots of later. So we've done enough of my bio, and this is just a little information. So if you wanted to see some of the stuff that I've done in the past few years. Also, this is Tiffany's background, which Gary went into really well as well. And Tiffany will be joining us next week, and she's going to go over one section of the workshop. So we're going to start with advocacy of teledentistry because I think it helps put things into context, and it also helps us understand where other states are, where we are as in Missouri. So we're going to start with that first. Teledentistry in its earliest phases has pieces of it that started back in the 70s and 80s, and those were mostly within government programs. So the U.S. Army was trying to figure out ways to coordinate dental records between different bases and communicate, patient needs, and so they figured out a way in the early days to send data back and forth with military records so that people could do that. The next thing is that there started to become technology that actually helped enable these systems, so much so that there's a big gap there, maybe a 15 to 20 year gap before the real first use case of teledentistry took its footing, which was the virtual dental home model that was established by Dr. Paul Glassman in California. So Dr. Glassman implemented a great program that put a dental hygienist or an expanded function dental assistant out into the community. And while he was working at the University of Pacific's dental school, they established this program where hygienists and EFTAs went out into the community, and they were able to triage patients, collect their data, diagnostic data, store it in the cloud system, and then the dentists that were tied to the program would monitor those patients and figure out who's a good patient to be seen out in the community, or maintained out in the community, and who needed to come into like the dental schools or the FQHCs or the other offices that would see these patients. And they were just showing a good 10 years of good outcomes, and that's very well documented. You could find some great literature, and we'll touch on that a little bit as well. So also in 2013, fast forward, that's when I graduated dental school, and in 2014 I started the advocacy. So because I saw what Dr. Glassman was doing at some presentations, and I just asked the Dental Board of Missouri, hey, can I come and ask a question to you? So I went to the Dental Board and just went up to the they asked for some information ahead of time. I sent it to them, and then I just proposed the question of, hey, can we do this here, and what's stopping us from doing this? And they were very open to the concept, because they knew there hasn't been a lot of traction in how to address particularly vulnerable populations and rural populations, and they were really interested in new concepts to do that. And from there, I was asked to be on a task force subcommittee of the Missouri Dental Association, and we kind of came up with our position and different ideas of how we could incorporate teledentistry into the Practice Act. Legislation doesn't happen quickly, and so it took, as you can see here, 3 years for it all to be voted for and adopted, and for the billing mechanisms to be put in place. But we not only gained in that period of time teledentistry as a legal option to implement it in our healthcare system of Missouri, its regulatory environment. So we passed legislation defining it. We also passed in that law. It said that Medicaid had to pay for teledentistry and define that. And then we also had the secondary track legislatively, where we had to change the Practice Act separately. So we worked with the Dental Board to also make it definable in our Practice Act very clearly on how you can implement that. And we'll get into that in just a minute. So those things took maybe 3 or 4 years, and in that period of time, I had been testing the components of teledentistry with Tiffany at Comtree, and Sandy's on the call too. She was a big part of that. And so we worked on the pieces of teledentistry, knowing that we were going to be going live with this because it was getting really good support across all the associations that care about oral health initiatives. And so from there, we got a grant to then start doing it before it was reimbursable by the state, and that gave us a good platform to experiment and innovate and try it in different ways. And so we tried it at Comtree at nursing homes, at schools. We also did it in the youth detention centers, and we also did it in the primary care office at 2 locations for Comtree. So we tried it in different areas to see, which areas had the most pain points, where was it making impact, where were we meeting people, and that was a really exciting pilot program that we were able to work with, thanks to the funding from Missouri Foundation for Health. So midway through that project, the billing mechanism through Medicaid kicked in, and at the same time, the legislature added a limited adult benefit to Missouri's Medicaid, and we used that as a tool to meet that demand. You use teledentistry to help rise up to that occasion, because you can imagine we didn't have Medicaid adult dental benefits for 15 years or so in Missouri, and so there was a surge, and teledentistry gave us just one more tool in our toolbox to meet that demand. And then most recently in 2019, HRSA awarded the Missouri Department of Health a grant to promote teledentistry and educate, and that's what this workshop is part of that workforce grant, including some funding to help seed startup projects similar to what we did at Comtree. So we're going to try to replicate what we did at Comtree with other grantees, and then we're also doing these workshops. And I'm also just available in general through the Department of Health. You just request them and they get you in touch with me. or reach out to me directly. So next thing we'll go into is the growing body of literature around teledentistry, and that there is a need for more innovations. So just to put it in context of the demand out there, because I think that's the important part when we start talking about teledentistry, is how it can help reach more people. And so if you could see here, this is some really cool data that came from the Health Policy Institute, which is a think tank within the American Dental Association. Between 2006 and 2012, during the Great Recession, we had a decrease in dental visits by about 7% across all industries, okay? There was a 7% drop in dental visits during the Great Recession, and then 5% increase in the U.S. population at that time, and 9% increase in the amount of practicing dentists. Meanwhile, in regular dental offices, there was a decrease about 9% of patient visits, while there was a huge surge in the amount of patients visiting federally qualified health centers, almost a 75% increase, and the hospital emergency room, which is the worst place for patients to end up in. Okay? So this just adds a little context to like the state we were in around the time that we were advocating in Missouri for teledentistry. We were trying to meet that hole to the access to dental care, because people were going to emergency rooms, people weren't going to private dental offices and as much, and they were surging into health centers at the time. And where teledentistry comes in is teledentistry, if you think of operationally, when you run a dental program or a business, which is what a dental office is or a dental clinic, that there's the thing they call the cost curve, okay? And so in the cost curve, you've got things to the left that cost the least, and you got things to the right that cost the most. And the most, this is for people to deliver as a business, okay? So doing nothing costs the least to do as a business, and doing the most expensive thing would be doing hospital dentistry. The costs around that is very high, and going to this and having specialty care. And teledentistry fits in this niche between just having a screening program to offer and portable dentistry, okay? In the cost curve there, it fits right in there. And particularly when you're talking about a teledentistry program like the one that we did at Comtree, where we're doing portable dentistry or mobile dentistry, okay? But we'll get into more applications than that. When I was at Comtree, I had luckily had two eager fourth-year dental students that needed a project to do, and so we actually did a cost analysis of what does it cost for checkups, cost the office, like as in fixed and variable costs of the health center to see people the traditional way for checkups, and using portable dentistry and going to them, okay? So what we found was pretty interesting. We found that visits were on average 10 minutes shorter, which is awesome for the patient. And we found out that the visits cost about $84 less per visit. Okay, so almost $100 when you're talking about a visit. That's huge, less, because you can see people at a lower cost threshold and hopefully decrease the cost of care and figure out a way to see more people, and you might even be able to scale that up and drive the cost down even more. And so the biggest factors were whenever you had a teledentistry visit, you didn't have to wait on the dentist. There's the 10 minutes. That's mostly where the 10 minutes went. And the dentist is just going to review the record later, and it doesn't take chair time for the patient or the hygienist or the dental assistant. The next thing that we noticed really quickly was that when you start looking at the cost, the biggest cost saving is both the time for all the team members, because they have to be firing on all cylinders to make an efficient visit whenever everyone has to touch the patient, versus, so there's some cost savings there in time. But the biggest impact was that when you have a portable dentistry program, the cost to operate a portable program without having to pay for a fixed building with rent and with utilities and all those things that go with that, and is significantly less. So the cost to then expand your practice outside of your four walls is lower than if you would just open a satellite office. Okay, so that's just another way of looking at it. This is just kind of the same things that I just said, just kind of in bullet form. Our methodology of how we did it was we compared our portable program visits, and we compared visits at 3 of our locations, fixed locations, and kind of averaged the 3 locations because each one runs a little bit differently. And so we tried to get an average there. And what we did was a total of about 45 patients, and it was like 25 patients in portable and 20 patients in there. And then we looked at the cost for, we counted how many minutes every person took to work on that patient. And that's kind of how we looked into how much that cost. Oh, we also, one other interesting thing was the patients that had a teledentistry visit were far more, whenever someone would go out portably, were far more likely to get their sealants at that initial visit than they were if they were in the office. For whatever reason, the patients in the office were less likely to get a sealant. And so there's something to think about there when you're setting up your program. And it also reflected back to us, at the dental director at the time of, hey, what are we doing wrong in the office? Why aren't we offering sealants at that same visit? So it was interesting to discover that as well. In the literature, there's some good stuff. This was from the University of Minnesota School of Dentistry. They measured the distance people had to travel just to get an oral pathology consultation compared to like in a rural setting versus just staying in your rural setting, and a provider in the town would send information to the pathologist, digital pictures and x-rays and things like that, versus them having to travel for the day to the city to get checked. And so what they found is that the differences were, you could see the huge difference in travel distance. It's the difference between traveling 12 miles and traveling 230 miles, and the difference between missing an hour and almost 2 hours of school or work and missing 18.3 hours of school or work. So some pretty significant convenience savings. And when you're talking about Medicaid programs and things like that, like we have to pay for travel and transportation, that's big savings for them in the schools as well as employers. So some great things in the area of convenience and travel. The next thing is about accuracy. So I get this question obviously a lot. How accurate? How can you really do a teledentistry exam? When you can't see my patient and touch them. So and I get a lot of questions about soft tissue. So this study was in Germany and France on 235 patients, and the patients got a teledentistry visit and an in-person visit, and they blinded the surveyors. And so they found that 55% had dental pathology, and the sensitivity rate was in the mid 90s, which is really good for a sensitivity of a survey, and only 6 false positives. And if you're doing an oral pathology study, the best kind of false reading to have is a false positive, because at least you're going to go in and then figure out that, that wasn't anything after all. So the bonus thing that they also discovered in this study was that the teledentistry visits, again, were 12 minutes compared to 20 minutes for a face-to-face exam. So you get something that is 8 minutes less per patient. Patients don't have to travel to see the provider, and the sensitivity of accuracy of this study is very high. So that's really good, okay? Next is literature from the virtual dental home model, which is what Paul Glassman at the University of Pacific did. And then this shows that what they did was they brought in 29 patients, and all 29 patients had 3 exams done. They had 2 virtual exams done and an in-person exam done. And they all were done by 3 dentists. So each patient was used multiple times by the different people, and they blinded them, and they found that that what they found was there's very little difference in treatment outcomes in general with the patients no matter which way they were examined. So the patient's treatment outcome stayed the same, very often stayed the same amongst the dentists that reviewed their record 3 times. Okay, the only difference that there was between dentists, which we all know that you get 4 dentists in the room, you get 9 ways of doing something. So it's very, and the next day they could change their mind again. So what you find here is, again, very similar outcomes, and the study is very positive towards teledentistry. So a little bit about what teledentistry is. So the definition from the ADA is the means for a patient to receive services when a patient's in one physical location and the dentist is in another location than the care provider that oversees delivery of the services. Okay, so that's the definition. They released that in 2017. So you've got association support for that. But the key thing that I want you to remember about teledentistry is that it's the same standard no matter which way. It's the same standard of care whether you're in person or you're doing it virtually. Okay, you have to remember that. So you don't, whatever kind of teledentistry you're doing, and we'll get into different tiers of applications that you can use. If you're going to do something like a limited triage, you got to be honest with yourself and the patient about what you can actually do just zooming with the patient. You can't get a differential diagnosis. So what you're going to get is something different than if you're offering teledentistry with a trained, allied dental professional like a hygienist who's going to, send you records where you can actually do a differential diagnosis off of. In Missouri, we passed Senate Bill 579, which is the law that said that we can do teledentistry both synchronously and asynchronously, and I'll get into that in a minute. And in Missouri, we changed the way we changed our statute to allow for teledentistry is in the definition of a patient of record. Okay, so if you see this list right here, the first sentence in that first bullet is the patient of record definition. So it's one for whom the dentist has obtained a relevant history, performed an examination and evaluation, and condition to be treated. All right. What they did to allow for teledentistry is they added a giant run-on sentence to the end of that essentially allowed for the patient to be established remotely with a dental hygienist by a dentist that's delegating supervision under general supervision. Okay. So a supervising dentist may delegate to a licensed dental hygienist the collection of information and measurements necessary for the dentist to perform an examination prior to the dentist performing the examination and evaluation, and does not need to be physically present when the information and measurements are collected. So that's how our state dental board wanted to allow for teledentistry. It is under general supervision. Okay, it's completely separate from the public health setting stuff. So that's a completely separate story on provision of preventive care. That falls under public health setting rule. Okay. Some important terms, legal terms to remember, and I'll get into this again in a little bit. There's the originating site and the distance site. So the originating site is where the dentist is located, or is where the patient is located, and the distance site is where the dentist is located. Okay, and those need noted in your notes. You have the synchronous and asynchronous style of visit. So these are the two main ways you would classify. We call it the methodology of your visit. Okay, so you need to document in your notes the methodology of your interaction with your patient. Okay, synchronous is what most people think of when they think of telehealth in general. So talking to your psychiatrist, talking to your primary care doctor, and even talking to your dentist can be done synchronously through Zoom or BlueJeans like we have here, if you have HIPAA version, and you can interact with them. And one downside with COVID was that most dentists, especially private practice across the country, had no interest in teledentistry until COVID happened, and when they were introduced to it, they were introduced to synchronous teledentistry with their patients directly. Okay, and so that is cemented in their busy minds, and they haven't thought a whole lot about the other ways you could do teledentistry. And so hopefully one of the biggest things I can help you understand is that there's multiple ways to use teledentistry, And the primary way before COVID that teledentistry is getting used was asynchronously. All right, that's why I have that medallion right there. So you have that badge, that ribbon, because asynchronous is how dentists and dermatologists and pathologists use telehealth. Okay, because the record doesn't change that much between 2 days ago and today. Okay, and so gathering diagnostic data and reviewing that at a different time or place is sufficient for a teledentistry evaluation. Okay. So there's 2 different codes for that. There's the synchronous code D9995 and D9996. Those are majority, unless in Missouri we're lucky that they are billable codes, extra billable codes for Medicaid, but private insurers are not going to pay you more for those codes. Okay, so that's usually my next question I get from people. How do I bill for it? Well, the answer is you bill out, and I'm going to get into this more in a little while. You bill out what kind of evaluation you're doing, any imaging that you're doing, and the form of teledentistry. The form of teledentistry is not going to get paid unless you're a Medicaid in Missouri. All right? That other code is an administrative code that tracks the visit and indicates that it is a telehealth visit. Okay? So it's important. Use the code. Don't expect to get paid for it. There are some other ways to look at telehealth, okay, and I'll get into those throughout the workshop. But the other one's direct to consumer, which this is to be kind of an older way to look at it, direct to consumer, because direct to consumer can be asynchronous or synchronous, but it's just a way to consider that patients can send you information. You can communicate directly with the patient, okay, but you're very limited in what you could do. All right. And in medicine, they have what's called live patient monitoring. And so I'll get into more examples of that. But live patient monitoring in healthcare in general is very common when like you're discharged from the hospital and you have certain conditions. They want to monitor you and they send you home with equipment, and they're getting billed they're billing the insurance company or the patient to do that, or and they do that for lots of different chronic diseases. A lot of people have pacemakers that are connected to the internet, and they are telling the doctors whenever something wonky happens. That's a connected device using live patient monitoring. And there is stuff getting developed, and I'll show some examples of those, of ways that dentists possibly in the future could be using tools like this. I'll skip that one. That's just kind of how direct-to-consumer works. We'll get into that later. But like I said, in Missouri, Medicaid does actually cover both codes, D995 and 996. MoHealthNet will pay $14.60 per code getting used. Okay, so if you see a patient over Zoom or whatever, and you're going to build a limited evaluation, let's say, and you're going to build the D9995 synchronous code. So those 2 codes would get closed out for that. If your hygienist was going to see a patient for recall, and you're going to review that tomorrow or tonight, you would close out all of your X-rays. You'd close out all of your if the patient has already been seen and can get preventive care that day, like they're a patient of record, for example, if it's recall, they are a patient record. You could close out the prophy, close out the fluoride. You could close out the recall, and then if it's Medicaid, you can also bill for D9996, the asynchronous code. You always close it out, no matter what type of patient, Medicaid or not, because the insurance companies do need to track what kind of, and legally you need to indicate in your coding what you're doing, and so always code for it, but private insurers will not pay for that extra code. Also, there's this thing called telehealth parity. A lot of it was kind of thrown out into the wind whenever COVID happened, but essentially Missouri has telehealth parity, saying if you could pay for it in person, we'll pay for it whether it's done through telehealth. And there have been lots of it was hard to get before COVID. It was hard to get an insurance company to admit that because it wasn't usually in their policy manual. But I've had Delta Dental and I've had Aetna dental directors of Aetna and Delta Dental on webinars with me saying, if you can do it over telehealth, if it's an evaluation you could do in your state and it's legal, do it, and we'll reimburse you no matter if it's in person or not in person. The other thing, major thing to know with telehealth is you need informed consent. Okay, all forms of telemedicine, telehealth require informed consent. So you need to make sure that you have some sort of extra documentation that the patient is consenting to telehealth. And you'd think that kind of sounds silly that a patient is going to Zoom you from home needs a consent to that, but they need to. All right, and then also whenever you're going to say you're going to have a hygienist. Or in some states an EFTA see the patient and collect data, they're signing something knowing that they're not talking to the dentist, they're talking to the hygienist or the EFTA, and that the dentist is going to review their record or jump on a call with them and Zoom with them or whatever. So you need to do that. You also need to consider HIPAA. So HIPAA was kind of, there was some relaxed HIPAA rules during COVID, but people are starting to, now that people are getting their feet under themselves, they're moving to make sure that they're ready for when HIPAA is fully enforced again. So people are moving back to some of these HIPAA compliant options. So make sure whatever you're using is HIPAA compliant. I did do some webinars with the ADA and made some resources for them. So you can find some guidance from the ADA's website on teledentistry, and they have a really good guide on there. This is statements about OCR, how they are going to relax enforcement of HIPAA as long as you are, I'm going to quote them saying, the provider is in connection with good faith provision of telehealth. That's okay. Okay. They want you to be able to reach your patients right now, no matter where your patient is. If your patient's got pre-existing conditions and they're really reluctant to get out of the house, they want you to have the tools to access that patient and keep them healthy. Okay. Another regulatory side note is that if by chance you need to prescribe a narcotic, which we're all doing our best not to do that unless absolutely necessary, if you had to provide an opiate, the DEA came out with guidance during COVID that you have to do a synchronous visit to prescribe a narcotic. Okay, so if you are going to prescribe opiate medication, you cannot do an asynchronous visit. You have to do a synchronized visit over video conference. Also, the ADA has some coding and billing guidance that's available on their website, where they kind of go into a very nice outline of coding, and also some information about informed consent, like they give you a sample for informed consent. So now we're going to move into some real-world examples. I wish there was, once I'm in presenter mode, Gary, I can't see any comments anymore, it seems like. So I don't know if anybody answered. Right now would be a great time just to take a quick break. Have there been any questions, Gary? Because I can't see them. Oh, I think I figured out how to do it.
Let's see, from Carmen Vaughn. Hi, Dr. Suter, do you have some type of SOP available?
So I'm guessing she's talking about like policies and procedures, like how to do it. Carmen, if that's what you're talking,
I think that means standard operating procedure. Yep. Yes.
So if you need, I have a sample that I could give you. It's for outreach. It's for the outreach setting, but not in the office. So, or it doesn't, and it also does not yet include the limited valuation, but it could get you in the right direction. So, yeah, just reach out to Tiffany and I. Shoot us an email. And if anybody has any questions, like drop them in here. We can kind of take a break if you want. Otherwise, I'm going to move forward to some real-world examples. And some of them, I think one or two might have a video. So we'll see. While I'm doing this, if you guys get some ideas or whatever, I'd love for people to just put into the chat box, like just you don't have to do anything except write, how you're using it. Are you using things for, limited evaluations? Are you doing recall with it? Are you doing post-ops and things like that? I'd love to kind of get your feedback. So the first example is the Arizona School of Dentistry, which is the sister school to Mazdo in St. Louis. They have a teledentistry director, Dr. Scott Howell, and so they do 3 days of classroom teaching around teledentistry. So the second years have a 90-minute introduction to what teledentistry is and what digital records look like, and then they have a 2-hour group exam where they use digital records and they answer questions like kind of like a. Have you ever done a Kahoot? It's like trivia. People use it for like trivia online. You can do like multiple question answers. Like he'll pop up a thing. He'll say, what do you see on this? Is a PA lesion, whatever. So he'll put those up there. And then next they have they also do an in-person lab that I'll get to, but they do a 2-hour group project where they design a teledentistry program for their office or wherever they think they might end up one day. So that's a pretty good exercise to go through. And then they have a 3-hour lab where they learn how to use an intraoral camera because you're not really taught how to do that in dental school. So, and you can't really teach your hygienist how to do it without knowing how to do it yourself. Because I will say in implementing a teledentistry program at Comtree and training people at other health centers, the hygienists usually aren't trained on taking intraoral pictures or taking even orthodontic pictures. So getting them comfortable taking pictures and getting them as quick as they can be with x-rays takes a ramp up time for sure. So here they are. They also go out to the youth detention centers and they provide portable dental care using teledentistry. So they'll go out there with the hygienist and learn how to take pictures on people. Then they sit down and they review those records with Dr. Howell remotely at the dental school, and then they schedule follow-up days to go and do the care. So pretty good program. So that's them at the detention center. They also go to a rehab facility where they see special needs patients as well. And then this, I think, is a video, but this is the initial pilot program for the virtual dental home that was established by Dr. Glassman. And so I'm just going to break this up so you don't have to hear me talk the whole time with these couple quick videos that kind of show what people have been doing.
Dental disease has reached epidemic proportions in low-income children and vulnerable adults in California. It's getting worse. 24% of school children have never seen a dentist. Among Latino and African American children, over 50% have experienced dental decay and almost 1/3 have untreated cavities. Untreated dental problems are also common in institutionalized elders, disabled adults, and other vulnerable populations. The Pacific Center for Special Care at the University of Pacific Arthur A. Dugoni School of Dentistry has developed a new model to address this problem. It's called the Virtual Dental Home.
Virtual Dental Home is a new system of care. It's designed to move oral health services into community settings where vulnerable populations live and play and work and go to school and receive social services and general health services. In this system, we have dental hygienists and assistants who are able to be in those community settings, collect records, and post those to internet websites where dentists can actually access the records and establish a collaborative system of care between dentists in their offices and these community professionals who are working in community settings. Once the dentist has reviewed the records, be able to decide who can be kept healthy in the community and who needs to come into the dental office to have treatment completed. It'll actually be easier to get people into dental offices with this system because the dentist will already be familiar with what kind of work people need to have performed.
The beauty of this technology is that I'm able to take photographs and radiographs and any other dental findings on this child. It goes into a secure server, and then the dentist is able to access this information in the privacy of his own office without having to be on location.
This system is terrific. It allows me to evaluate Grace's records without having to be present. After Grace has been examined in the community, those records, x-rays, and photographs can be uploaded to the system. Then I can log on and review those x-rays and photographs from my office. These are Grace's x-rays that were taken while she was in the community. After evaluating these carefully, I noticed there are several areas of concern that are going to require her to come in for dental treatment.
And now, there are a number of things I can do for Grace to keep her mouth healthy in this community setting. I've just applied a fluoride varnish and also provide dental sealants and other preventive measures.
The virtual dental home system is being launched across California in places like schools, nursing homes, community clinics, and group homes. This new system of care bridges the gap between community sites and dental offices and clinics. It will keep children, elders, disabled adults, and other low-income vulnerable populations healthy at a lower cost than other systems of care. This system will make a significant difference in the epidemic of dental disease across California.
Great. And then I was just going to go in a little bit how I use it in my private practice. So a little differently. Before COVID, what I was doing was I was really using it as a way to cover my office whenever I'd be out of town or on vacation, or once or twice last year I got sick, so and I was too sick to come in, so I only had to cancel my treatment patients, and my hygiene patients were able to still come into the office. So looking at it, it was about 20 extra hours per month I was able to maintain just by using this system for that purpose alone. And so what would happen is the recall patients would still be able to come in and be seen. So it worked out really great. I wanted to show you guys now a little bit of what my schedule looks like currently post-COVID. And I'll get into this in a lot bigger detail next week, but I have what we call the a hybrid schedule, where I have a mixture of in-person treatment that day and teledentistry examinations to review. So if you could see the schedule here, I have 3 ops in my operatory, okay? I have one that's a closed room where I do my aerosol production. I have a non-aerosol producing procedure room. And then I have my hygiene room because, and I'll have limiteds come in and take x-rays, because I actually have we were a 3.5 day a week office with a hygienist and dentist here every day. We're now a 4.5 day a week office where 2.5 days I'm doing treatment only with no hygienist in the office, and 2 days where hygiene recall is done on a different day, all right, when I'm not there. So 2 days she's doing recalls, and she's actually sometimes seeing limited patients that want to get in to see me, but they come in and get x-rays, and we come up with a treatment plan or referral plan before they come in and see me, okay? And so we're doing that mostly to mitigate the amount of people in the office, but also just to get as many people, get the volume back up to a maintainable amount to be sustainable in this new environment, okay? And I'll get into all the kind of nitty-gritty analysis of that when I talk about sustainability and program management, but in the second day of the workshop. But essentially, if you look at this column, I use the hygiene column to just have some people come in for x-rays. But then on the right side, I have spots in my day where synchronous visits can happen with FaceTime. And so I'll have 1 or 2 patients usually use those spots where it's a patient I want to check up with, but I don't necessarily need them to come in, or I have a patient that booked a synchronous visit with me online and they want to talk with me before they come in. All right, and I'm starting to see a little bit of an increase in those types of appointments getting booked in the last few weeks, where people are kind of a little more leery to get out, I guess, or maybe they're on lockdown because they've been potentially exposed, so they're kind of leery to go out. So people have been booking that, and I kind of triage their problem, all right? And then I also have treatment consultations with people. So if someone has a treatment plan and they want to talk about other options, they book that time in my column, my synchronous virtual column, and I can hop over to a computer and talk with them and go over treatment plans with them. And I'll get into that a little more with the applications of teledentistry. Then at the bottom, you'll see that I have my asynchronous patients organized at the bottom of my schedule. And that's just a hack that I have, because asynchronous visits are just record reviews of patients that my hygienist did recall on the day before. And there's no good way in the practice management system to organize those patients. So one hack to do that is to just put them at the bottom of the next day's schedule. But when you start to get into, you start to get busy, you got to maintain tabs on those patients so you don't miss them if you've had a busy day. So that, because usually you want to get those done within 48 hours. So this is a hack that most people are using when I talk, and I'm talking to my consulting clients. They're just putting them in the end of their day as a reminder. But I've been working on a better way to do that, and that's using a task or a program management system that kind of organizes your patients and allows you to chat with your care team about what to do with them. So when I said that I am the co-founder of Helier, we're building an application that you can organize your patients like a project management tool. If you guys have ever used like Asana or a Kanban board, and you can see your patients in queue so that you know which ones you have to do first, and no one drops the ball on that patient. They're just sitting there for you to review the record and then pass the baton to the next person in the care team, because you're going to review the record and then you're going to pass it to the treatment coordinator to call them back and tell them they need an appointment, or to just call them back and say, hey, everything's looking great. We'll see you at your recall. Or, hey, you drag them over to the recall or referral part because they need to go and see the specialist. So that's just a new way of organizing, and there's no tools out there that allow you to do that. So that's what I've been busy trying to do, is find tools, exhaustively look through tools that are available, and not had any luck. In my practice, this is just a snapshot of what we've been doing. So you can see that last year in 2019, I only did 40 teledentistry visits. But as COVID hit, it's gone exponentially up. So it's actually somewhere in the 150 range, I think, now at this point. But that's the amount of uptick in teledentistry visits. And that's my ratio really between synchronous and asynchronous. My goal is to always do an asynchronous visit, and is because a synchronized visit can be a time waste, and you're not getting as much as you can out of your time, okay? And we're all strapped for maximizing our schedule because of the limitations with our new guidelines and how many people can be in the office and sterilizing and the amount of PPE that you have. So I like to be as efficient as possible. An asynchronous system is the most efficient way to do it. And you can see on the left side, right side, that most of these were limited evaluations, and that's because people were on lockdown and a lot of people just needed to catch up because they had fires to put out. But more and more of them are recalls that I do every day. This one is an application.
You may not be aware of this, but tooth decay is the number one most common chronic childhood disease. It can lead to bacterial infections, malnourishment, and a number of other dangerous outcomes. For families living in rural areas that don't have access to reliable transportation, it can be extremely difficult to see a dentist on a regular basis. And that makes treating pediatric dental disease an even bigger challenge. Need to Know's Michelle Fowles shows us a high-tech solution helping children who live far away from a dentist.
Look. See? Oh, there's you. Look at you. So we're going to show the dentist in Rochester your teeth, okay? Just like that. See, look. 1 in 3 preschoolers already has tooth decay. And the largest population is low-income, racial and ethnic minorities, children with disabilities, and we have a lot of those people in our populations, and with their barriers, it's hard for them to get. So I will tell you this, Dr. Sean, she's having a little issues with bleeding gums, which is a little bit beyond normal gingival inflammation.
So my name is Sean McLaren. I'm Program Director at the Eastman Institute for Oral Health for Pediatric Dentistry, and I'm the interim chairman of the Pediatric Dental Department. Been doing the teledentistry program since April of 2010. Where do you like to play? On the playground? Oh, fantastic. Do you like the slides or the swing better? For the teledentistry program, our numbers have been increasing every year. We're 50 or so patients that we'll see this year. We do everything that can be done in the typical dental chair, just we're in an operating room with it. The kids that we're typically taken to the operating room probably have anywhere from 10 to 20 cavities on their baby teeth, and for a 4-year-old to have 10 fillings done, not that easy. Patients that we're seeing oftentimes have other social issues. Oftentimes they're on some type of state or federal dental insurance. They're usually a little bit lower socioeconomic status, and they have a lot of other barriers or issues that prevent them from seeing the dentist regularly. Oftentimes there's not a dentist in their town that they're living in, or a dentist that accepts their insurance. So what winds up happening is they have to travel 50, 60 miles to see a dentist that's able to accept their insurance, or a pediatric dentist that has the expertise to treat their child appropriately. So through this teledentistry program, what we're trying to do is we're trying to eliminate that, at least that initial visit to the dentist.
My name's Melissa Green. I'm from Red Creek. This is Jason Green. He's 6 years old.
Excellent job. Those are pretty cool ones you picked out there, Mr. Jason.
Yeah, I have a whole monster bag with a whole ton of them.
There's a little the mesial decay on G.
Yeah.
You're doing excellent, buddy. Thank you so much. Been really big. We're almost done already because you were so good at this. It looks like it has a
resin on L?
Yeah, it looks like it has a resin. Yep.
That was really cool, getting a close-up shot of all of his, I like to call them teeth bugs, and issues that are in there, and the dentist in Rochester was seeing it at the same time. And since that was pretty much an online consultation, we can go right to Rochester and get the work done. We don't have to go there, have a consult, leave again, and then come back for the work.
So Pat will help set up everything with you there, Mom, okay? To help coordinate the appointments and scheduling and everything. Okay?
All right. Well, we'll see you later. We'll see you next time in Rochester. How's that sound? Sounds like a lot of fun. Perfect. Thank you. Bye.
Cool. This other one is just 30 seconds. This is Virtudent. It's a company that just comes on site. A dentist reviews records and at people's work, and people get their cleanings during a break. Cool. And then I was going to show you this too. So like this is a new innovation that is pretty neat. So this could be something that I'm just giving you guys kind of some examples of different things out there so that you get your wheels turning. Okay. So this system here is an app a parent could have. They're making this thing pretty inexpensive, like $25, something like that, where you could just have it with the free download app. And the people that make this are wanting people to have it in their medicine cabinet to send their doctor a picture. That also has different attachments. They even have an ear attachment coming out soon. You can show sore throat. You can show a problem with a tooth, and then also some. Medical doctors have these or using these and sending it to dentists. So some really interesting ways of using these. in my office, we've been using this as well. Just we find that the camera on the picture on an old camera that's not even being used as a or an old phone that's not even being used as a phone anymore is really nice. The images are clear, it's fast, it's predictable, and it retracts while you're taking the picture, which is super nice.
Mom, I have a store mouse up here.
Telescope. Open wide. I'll just snap a photo to send to the doctor.
The inventor of that, she won Shark Tank, so pretty interesting. Let's see here. And then what I'm looking forward to is I just ordered one of these this week, and these new scanners, if you happen to have a scanner in your office, this gives you one extra way you could use it.
A platform that allows you to see beyond the current spectrum of what's possible for patient engagement and digital workflow. Hi, I'm iTero Element 5D, and I add a new dimension to your practice. With one integrated scan, I provide an array of powerful visualization capabilities at your fingertips. I provide you powerful tools to aid in your diagnostic, restorative, and orthodontic workflows. I'm the first integrated dental imaging system that simultaneously records 3D, intraoral color, and near-infrared images and enables comparison over time using iTero time-lapse. NIRI helps you see your patient's internal tooth structure to aid in detecting and monitoring the progression of proximal caries from multiple angles. My built-in intraoral camera pairs with NIRI technology to take clear, precise images, giving you a new level of visualization. Rotate the 3D model and watch as I match the NIRI images and intraoral images with the angle of the scan in real time.
And then here we talked about connected devices, so this is just a clip of this one.
Now another thing that can have a long-term impact on your health, failing to take adequate care of your teeth, mouth, gums. Research shows possible links between gum disease and chronic illness, like for instance heart disease. Last year, we introduced the Sonicare connected toothbrush and app as part of our oral health care platform. And it's been really an outstanding, huge success. It uses smart technology to automatically analyze your brushing technique. It then provides you with tips and tricks how you could improve it. But how many of us are really confident that we're doing enough or be in between dental checkups? And is it good enough to prevent problems? So based on this user feedback, this year we are introducing our new Sonicare Teledentistry service.
I've always tried to take good care of my teeth, but after a recent procedure, I found myself in need of a little extra reassurance. Now with the Philips Sonicare Teledentistry app, I can get advice from a fully licensed dentist anytime, anywhere. And it's fast. The report arrives within 6 hours. It comes with treatment guidance, a personalized cost assessment, and product recommendation, so I can get on with life in confidence. Innovation in you. Philips.
So those are just some other ways that people are developing things and using them in different ways. And so this last one is just to kind of look down field a little bit, because this is happening in medicine, and a lot of times dentistry is impacted by what medicine's doing. So if you look at this is really kind of crazy stuff, but very interesting.
It's inevitable. AI is going to change healthcare as we know it. But in this video, I want to show you a few medical specialties where it's already making a difference. Radiology. In 2018, a deep learning-based algorithm was developed using more than 50,000 normal chest images and almost 7,000 scans with active TB. The algorithm became so good that in performance tests, it easily beat radiologists. Of course, it has its shortcomings, but this test shows that even the AI of today can be a helpful second reader for physicians, while the AI of tomorrow can bring screenings and precise diagnostics to even the less developed areas where medical professionals are not available. Dermatology. AI is advancing elsewhere too. Researchers in Germany, the US, and France trained a deep learning neural network to identify skin cancer by feeding it with more than 100,000 images of malignant melanomas and benign moles. After this training, they compared its performance with 58 international dermatologists, and the results were remarkable. While the dermatologists accurately detected more than 86% of the melanomas, the neural network detected 95% of them. Oncology. One of the biggest promises of AI is that one day it could crack the code of individualized cancer diagnosis and treatment. And Watson, IBM's very own AI, is a powerful tool that is mainly being used and tested in the field of oncology. So far, dozens of hospitals have adopted this technology, and it's being used in conjunction with medical judgment. While its promise is strong, it has not yet been able to live up to the expectations in the fight against cancer. Cardiology. Cardiovascular diseases are the #1 cause of death globally. Those affected, early detection is critical for both management and treatment. In the future, AI-based predictions could be a lifesaver. Since studies have shown that markers of cardiovascular disease can often manifest in the eye, scientists are using deep learning methods to identify risk factors such as age, gender, smoking status, and blood pressure only by looking at the eye. These new studies still need to be validated and repeated on more people before they become more mainstream and gain broader acceptance. But since retinal images can be obtained quickly, cheaply, and non-invasively, that will probably open new horizons. Well, AI has several limitations. Most of these studies have not been tested under clinical circumstances, and algorithms are only precise in a specific task, while clinical life is much more diverse than that. Nevertheless, what matters here is that AI has amazing promise.
So to close out this first piece of our lecture out here, I just want to let you know that there's lots of ways that you could think about teledentistry. I'm hoping I kind of overwhelmed you with lots of prospects so that you have a broader picture than maybe what brought you to the workshop. And hopefully I can kind of guide you through multiple different steps and ways to use it. So, and just to let you know that, you can feel free to reach out to me. I'm happy to answer any questions between now and next week on these topics. And then we also have a Facebook page that's for teledentistry users, our Facebook group. So it's called Mouth in the Cloud. You can jump in there and ask people questions, post thoughts that you have. But now I'd like to have just a little break. I'm going to ask you guys to feel free to go ahead and get a breather. If you need to run away for 5 minutes, we'll take just a 5-minute break. I'm going to ask that if you have time, click on this survey. I'll put it in the chat box and tell us what you're doing for teledentistry. And this thing just takes 5 minutes, and then I'll put the results up here and we could talk about it before we jump into the next section, because it'll help inform where people are at. So 5-minute break, and then we'll get going, and then we'll jump into the other half, which is about the different specific applications for teledentistry, and take it from there. Gary, did you have anything to say? I didn't see any questions, so you can also chat some questions in there if you guys have it.
No, there's no questions in chat right now, but we certainly want to encourage questions, and so type them in there as they come to mind, and we'll be glad to answer them.
Cool. It looks like maybe several of you have answered the questions. What we're finding here, feel free to still go ahead and answer those questions. I'm going to go ahead and fill up my water, but go ahead and answer those questions, and you guys can kind of see what other people are saying here.
And you do have at least one question in the chat, but we'll save that for when you get back.
Great. Okay, I see the question from Tremaine. So, how hygienists are using the teledentistry in their job? So, typically, the most common ways that hygienists are using teledentistry is that they are using teledentistry, and they're supervised usually under general supervision, and they're doing teledentistry visits. They're doing their regular hygiene visits, and they're capturing x-rays and their notes and their things like the things that they normally do for a hygiene checkup, doing their preventive care, but then they're also taking some pictures on top of that so that the doctor can review those and come up with a treatment plan. And it works really great and predictable for children and for stable adults that are on recall. Where it's really hard to do a teledentistry exam, it's not impossible to do it, but where you run into the fact that you have to change a lot of the treatment planning is when you bring in a high risk, high caries risk adult into the chair through a teledentistry visit first, like a brand new patient particularly. So those are more difficult. They can happen, and they're definitely doable. They just take a little more time, and sometimes you have to get the patient only through the disease control process and then talk with them about their goals before you put a whole bunch of time into the second phase of treatment for restorative and those kinds of things. But the other thing a hygienist could do is, like I said, in that outreach setting, they're going outside the walls of the office. Some offices, you don't have to be in public health, are offering services out in the community. So going to veteran organizations or going to a nursing home, and they're offering an ancillary service to broaden the way that they can bring patients into the practice. So those are the most common ways that teledentistry is used. I've actually heard use cases where people are actually offering a teledentistry service just to check up on patients, particularly their perio patients, using a video conferencing tool to promote those healthy habits and checking up on them for your perio maintenance patients, or your patients that might need a little extra oral health coaching. I've heard cases of people actually doing that. But those are the main ones for hygiene. What's a little different for hygiene that I've been doing at my practice is that limited evaluation patients are actually able to come in the same day on days I'm not there. And my hygienist has about 3 or 4 spots saved in the day for a same day emergency. So that patient comes in and they come in and she answers a very detailed question checklist of questions that I have her go through. She actually documents their symptoms and things like that. And then she'll take the PA and the bite wing of the tooth, and they'll take some pictures of the tooth, and she'll save that for me, and then I'll review those within a few hours. So even if I'm not there, I'll get an alert, and then I'll go on, I'll remote in, and I'll review that so that we can either get them on an antibiotic till they could come in, we'll refer them out if it's something that I don't do, or we'll at least get them triaged sooner than if they had to wait all the way till I had an availability for myself. So those are some ways. So that's a good question. I'll refresh this and just go through it a little more. So if you could see here, we're the people that have taken the survey, and it's not just you guys. I've been getting a lot of people to take this survey, as many people as I can. So please share it if you will, just to kind of get an idea, because the ADA has been surveying people to figuring out how many dentists are using teledentistry, but they're only asking people if they're doing it for limited evaluation and triage. They're not asking the whole picture of teledentistry. So if you see here, there's been a broad adoption of new digital tools, such as, teledentistry being just one piece of that. And then you've got, patients, a lot high adoption of digital forms and messaging your patients through text message. So a lot of that digital consents, another, thing that we weren't talking about before COVID was virtual waiting rooms. All very useful tools in the post-COVID world. And so there's a lot of adoption. But what I have been seeing here is that even if people aren't doing teledentistry, and it's around maybe 17 to 20% of the people taking the survey, 62% of them are highly likely in this scenario that they're going to adopt it in the future. So that's really promising. And you also see that people are fairly satisfied with their teledentistry solutions. The majority of them are in the neutral position. And that's probably because once you get in something as new as this, you wish it could do some more things than it does. And that's the limitation. You can see here that what codes people are doing is very diverse. The majority of them being limited triages. So the majority of people are have done at least limited triages. The next runner up to that is post-ops, followed by consultations. And then finally, there's quite a few people actually doing hygiene appointments using teledentistry. So another hygienist scenario is if an office has a satellite office, the dentist could be at one location and you could still keep the second office running for hygiene and monitor those patients with teledentistry at the same time. So some really cool value that the hygienist can add when they learn teledentistry. And then also of the people that are doing teledentistry, it looks like somewhere around 70% of them, or 60 to 70% of them, are highly or likely to consider new ways of doing teledentistry. Let's see here. I've been asking a lot about communication in these surveys, so because that is the one piece. There's a lot of tools out there for us to communicate or to do the teledentistry exam, okay? But there's not a lot of tools for us to not drop the ball with that patient like I'm talking about. And that's where I've been frustrated because, like, in the office we're using lots of sticky notes and we're, have, spreadsheets to maybe keep track of patients. But whenever you have teams that are spanned different hours of the day or different locations, you need a way to consolidate how you communicate and organize your patients so you don't forget about them. And so that's what I've been really working on and frustrated with as I'm a consultant and I help people solve their teledentistry problems, and that's one that seems to really get lack tools for. So we'll go into the second part of this today, and that is jump in right here. And this is just to show you how much of a spike there was in teledentistry awareness between January and August. So there was a huge spike in people searching for teledentistry. And so people are like, okay, what is teledentistry? I have no idea what it is, all right? And the ADA, like I said, surveyed, and that in April, 1 in 4 dentists were using teledentistry, okay? And there was more in the big group practices that were using teledentistry than in solo practices. And then when you looked at specialties, pediatric dentists and orthodontists were using it far more than prosts and endo. So pretty interesting to see that adoption. But what we also saw was that at health centers, over 50% of health centers adopted teledentistry rapidly, and when they resurveyed people 2 months later, they were still using it. Versus in private practice, if you look at the survey, this is the health center survey, and then at the bottom, it's the 2 surveys where they asked private practice dentists. 1 in 4 dentists were using some form of teledentistry for limited evaluations. That's all they asked them about in the week of April 20th. And then by the week of July 13th, 12% were using it. And that's why I've been trying to see if there's a better picture of how people are using it, because the ADA won't ask, or at least up to this point, even though I asked them to ask more questions, have not tried to prod and find out if people are really using it in other applications. And so that's why I'm trying to educate people on the breadth of applications, because the ADA only came out and told people about how to do limited evaluations, even though in 20 states in America, you can do lots of ways of doing teledentistry. So the first application, remember on these two terms, on all of these applications, you can do them synchronously or asynchronously. And I'm a huge advocate for doing asynchronous teledentistry as much as humanly possible, okay? So a little bit on the policy part. If you're not from Missouri, you should check out the Center for Connected Health Policy. It's a great resource, free resource. They'll help you figure out your local state regulations. Just a little disclaimer that to remember, HIPAA. Right now it's relaxed, but that won't last forever. So some of the stuff I'm touching back on again just because it's important, okay? Remember the DEA rule. If you're going to happen to prescribe a narcotic, make sure you're using synchronous teledentistry. Make sure you're grabbing informed consent, okay, at all times. And when you're coding, there's two groupings that you need to remember for your coding, okay? One is what type of evaluation you're using. So in this case that I'm showing here, if you're just doing post-ops or limited evaluations, you close out that code. That's usually the code you're going to get paid for. And then you're going to close out the methodology code, okay? You're going to close out the D9995 or the 996, all right? So just remember that. That's how the coding works. There's also some care coordination codes that you can use to track your patients through the process. I encourage you to use those codes so that you can track your referrals and where they're going, and you have a way to pull a report so you don't lose your patients. Again, I stress that you need a system to coordinate the care and not forget how to organize your patients as you start to see them in a new workflow, okay? So the next thing that's highly important is your case note. So your case note, again, it has to have the originating site documented, which is where the patient is located. It needs to have the distance site documented. And then when you also should document the patient presenter. So if your patient is talking to the dentist directly during the visit, that patient is their own presenter. If you're doing it to supervise a satellite clinic with a hygienist, the hygienist is seeing the patient, they're the patient presenter, okay? You need to also document in your notes what methodology you're using, so the D9996 or 995, and I've had some recommendations from the insurance companies that they would like you to document also what technology you're using. So just so that you could prove that, oh yeah, I did see Susie, she doesn't want to pay for this. She doesn't want to pay for this copay, but I did see her for this. I did it on Zoom. I know I did this because my notes are so documented. I did this on Zoom on this date, synchronous technology. And then you want to include some COVID-19 screening questions, obviously, some other things like that before they come in. And then remember, care coordination. When you do a teledentistry program, you need to care coordinate, okay? You need to make sure that you have a system in place to bring your patients in virtually to the point of care where they need to come in, they come in, and whatever follow-up care they need is done. And that might sound silly that I'm talking about that, but we have 4 phases that you should always remember in any application of teledentistry. We preach that you have care coordination first. It's the number one thing that you should do, because your regular workflow where a patient walks in the door and then they check in and then they sit at the operatory and then they come up to the checkout at the front desk, there's someone with that patient through that whole process. If you're implementing a teledentistry program or a way to use it, that workflow, pieces of it might work, but it is not like that anymore. You need to map out your whole patient workflow experience so that you know that you won't drop the ball of the patient on that whole journey to get them from needing to see you to they're back to healthy again and they're on recall. All right. The next thing is the data collection piece, which Tiffany's going to get into at the next part. She's going to get into the hygienist's data collection component. So for the hygienists on the call, that's going to be a great important one for them. Then the next piece is the dentist examination phase where they take all the collected data, whether it's from the patient or the hygienist, they review that information, and they come up with a treatment plan, and then they communicate that to the next step, which is the follow-up. So whatever system you set up, I highly encourage you to have the follow-up piece figured out too. What are your follow-up protocols? If you're going to just have a teledentistry program and it doesn't have follow-up, then you're not really meeting the whole scope of the patients. If you're going to offer the follow-up care yourself, you need to know that. If you're going to be going to see people and you're going to be doing like a community service kind of outreach thing, if using teledentistry to kind of help your community, let's say, but you don't necessarily see all those insurances, what do you do when you see somebody? You've made them a patient of record. What are you going to do to make sure you've documented that you are going to get them to point of care? Okay, because some programs are just about the prevention piece, but they need to think about the follow-up care piece and have that piece in place so they can coordinate that. So, the first application is the limited evaluation and triage. Again, it's what most people came into teledentistry understanding. And so what I do with my patients, this is an example of what I get. When a patient goes onto my website, they click a button and they send me a detailed questionnaire and they upload a picture into that, okay? So they send me that information and I receive it and I review that before I meet with them on a Zoom call. So here's my front of my website for my private practice. They click that button, they schedule an online Zoom with me, okay? And then they get a form to fill out and they submit pictures. Here's an example. I use this program called Calendly. Absolutely amazing. It changed my life. So highly recommend it. Great way to get on the same page with people that you need to meet up with in this new virtual world we live in. The next thing is have a good digital form that allows for remember teledentistry consent. Remember that part. And your health histories if it's a new patient, and your symptoms, signs, symptoms. And also you could throw in your slide in that piece about the COVID screening while you're at it. Have them fill that out, okay? So go ahead and do that. Have them send you that so that you review that before you jump on a Zoom call with them. And remember, you can have a synchronous or an asynchronous visit with your patient if you're going to offer this kind of service, okay? But I'm going to tell you right now that if a patient schedules a Zoom call with me, my goal is to always do an asynchronous visit as much as possible, okay? My goal is to not get on a synchronized Zoom call with a patient if I don't have to, okay? Because you can waste a lot of time that way. The patient could no-show you on the Zoom, and that it can be 8 minutes long or it could be 25 minutes long, depending on how well you are getting, going, if the patient's going down a rabbit hole or you get distracted because people come in your office. So just remember that you can do a lot of triaging just based off the patient telling you their signs and symptoms and sending you a picture, okay? And then sometimes I'll get a picture that I can't see. So I'll either tell my secretary to reach the patient and submit a new picture, or if I'm using like Weave or something like that, I'll send them a message, say, hey, great job. I know it's hard to take a picture, but can you pull your cheek out and like go by a window and kind of take another picture or two for me? It's kind of like a selfie. Like take a selfie so I can see if there's swelling, but also snap a picture near the window. And so I'll do that because I'd rather just review that and figure out if it's a wisdom tooth and I need to just refer them and they don't even need to come in, or if it's something that is they have swelling or not. Like I need to see that kind of information, and I can kind of prioritize based off of what information I get from the patient. And then if you go into that Zoom call, you have a lot of information and you can lead with that. You don't have to go down and extract information in a Zoom call in an inefficient way. Next, this is a big one for me, okay? Hygiene assessments and satellite coverage. I think this is where you guys, as we're emerging through COVID and we have to have new PPE requirements, new cleaning requirements, new social distance requirements, and spacing out, limiting people interacting, all that kind of stuff. Using teledentistry to do both application 2 and 3, hygiene assessments and satellite coverage, is where you're going to see scalable efficient use of your time and your hygiene's time, okay? And so, number one, it mitigates risk, okay, of exposure. So you're reducing the number of human contacts because the doctor doesn't need to come into the room, okay? And if you're using the hygienist to extend hours, the hygienist can work later than the dentist, earlier than the dentist, days the dentist is not there, different locations than where the dentist is. And so you're reducing human-to-human contact, okay? Your patients can stay outside and virtually check in. You can maintain a lot of distancing and time between interactions with people. And you can operate with those expanded infection control guidelines we're talking about. And you can create some availability for your patients, because if everybody's limited to by how much time the doctor has to see people, and you're also restricting how many people you see, that's what restricts access to the doctor, okay? So use it for recall, use it for triaging patients, and have them come in if they need to. I've talked to a number of dentists. They're calling them express X-ray visits. So patient needs a follow-up, they don't have to come when the dentist is here. If they need to, have a dry socket or something, just have them come in and take an X-ray. Whether it's a limited patient or not, they can just come in and get an X-ray, document the information, and they're out, okay? Again, it's a really good way of optimizing OSHA guidance. So if you look at this branch here, the top of the apex is the patient who is COVID positive, and the other two people, one's the hygienist, one's a dentist. And if you eliminate the dentist, all the people under there that were there that day don't have to get exposed if the dentist isn't even in the equation. And I'm going to tell you right now, it already happened at my practice where we had a positive exposure. The hygiene team took a week off to get tested and wait for results to come back. And I was able to keep seeing people with the treatment team because my teams don't interact. And so it kind of really frees up some of the stress of operating those situations when you have those potential exposures. We traditionally use pictures like intraoral cameras, like the mouthwatch camera. The extraoral camera we use is the Dyne Digital. It works great. It's more affordable than one of those big Canon cameras, and we use cheek retrievers and retractors. I'm super excited because I'm going to be getting a scanner, like I said, and I'm hoping that just really changes the way and makes things efficient and clearer and easier to use and operate. So I'm super excited for that part. But here's some of the stuff that we do. The patient comes in, they get their normal x-rays, all right? If they're on recall, they get their bite wings, they get their anterior PAs, and then the hygienist is a decision tree where she has to I have her take PAs of teeth that have suspicious lesions or symptoms, in addition to the regular recall film series. So bite wings PAs, and then a PA of suspicious teeth or symptomatic teeth. Next, we take orthodontic series of photographs. Whenever I started the first teledentistry pilot, we started with intraoral photos, and it was a mess to organize those and to figure out, is this 3 or is this 14? I can't really kind of figure it out. I can't see the whole picture. So an orthodontic series of photos is just a great way to give the dentist a perspective of what the patient's dentition looks like, so that you can then look at a zoom-in picture of the decision tree that we do is any teeth with symptoms or suspicious lesions get intraoral pictures as well. So these of that same picture patient you just saw in this previous slide, they get intraoral pictures of the symptomatic or suspicious teeth. And then how you set up the way you gather data is dependent on the dentist. If you're in a multi-doctor practice, I would highly recommend you all get together and you pick your data set, and that's the standard data set for your hygienist, and you train all the hygienists to that. And so one other example for this is in Dr. Scott Howell there in Arizona. He teaches his dental students to do quadrant videos, and so the mouthwatch camera, it has on its software ability to upload videos, and so he does quadrant tours. He does has the students do lingual, occlusal, buccal tours of each quadrant, and that's how that's one of the extra ways he teaches his students how to do their data capturing. And then here I had this is a different scanner that I used. I had a rep come in here and I tried it for the same a whole day for teledentistry patients. And this is that same patient that you just saw the intraoral pictures and the orthodontic pictures and the x-rays of. This is her scan of her mouth. And there's way more scans of this. I could move it, I can articulate it, I could see the occlusion lining up. Really, really cool and powerful ways to kind of look at your patient and come up with a plan. In addition, all adults get a perio chart done. So perio charting can help me decide if something's restorable or not, what kind of cleaning that the patient may need. And then the most important is the odontogram and the charting. So no amount of technology can replace a well-calibrated teammate who is a professional and who knows how to communicate the state of the oral health condition to their dentist. And so whenever you have a well-calibrated team of dentists and hygienists, that's where the magic happens, okay? So Tiffany and I, we've been together for 5 years working side by side, and now with teledentistry, she knows very closely how I practice and what I look for, and I've gone back and forth, and we have a very good open relationship of talking about, hey, this, and if I change something, I'll tell her how I changed it and why I saw it this way. And so she goes into the tooth chart, updates it, and then she marks with black spots on there suspicious lesions so that I know, oh, hey, she saw something or felt something on that tooth. I'm going to look at the pictures and the notes to make sure I could see what she saw. In addition, I'm looking at everything else myself just to see if I see anything, okay? And I might add to it or I might take away. So, sometimes she'll point something out, and I like for her to be more aggressive on pointing things out so that I can decide if I want to be conservative about it. So she'll put a lot of things down that I end up saying it's going to be a watch. But that's just a good way to do it because you'd rather have a false positive. And again, the other piece of that is that she submits those patients and we store them in a queue so that I don't lose track of them, okay? And so again, I'm kind of commandeering a task management and a patient management system so that I can keep my patients in queue. And she hands them off to me, and then I hand them off to my treatment coordinator to do the follow-ups, to plan the follow-up care. Okay, so the next part is for treatment plan consultations, and I'm going to throw follow-ups into this application as well. So application 4 is treatment plan and consultations, including follow-ups. So a lot of practices are using teledentistry to not even do billable services. They're just doing it for convenience of the staff, the doctor, the patient, because you don't have to bring a patient in to talk to them about, for example, a very common one is I got this tooth pulled at the surgeon a month or two ago, and I'd like to talk to the doctor about, what my options are to replace this. And they were just missing one tooth in an arch, let's say, for example. And very common one is a single tooth replacement. So, you've got a bridge, you got an implant, maybe you got a partial, or you got nothing. My recommendation is you pick 3 of them and you present the 3 things. You do it synchronously, okay? So you send them some educational videos when they book the synchronous visit. That is on your schedule at a time that works best for you to jump over and take it, okay? So you have a PowerPoint ready with examples of single tooth implants, all right? And you have that ready, and it's a very powerful tool to just jump in and say, hey, Bob, good to see you. I'm glad you're healing up for that. Got your inquiry. What'd you think about those things, that we sent you the videos? Oh, you didn't watch it? It's all right. I've got them right here. I could show you, some images of what our options are. So you could graphically show them, some 3D models or some pictures of what a bridge looks like, this or that implant. And then you could jump into even some cases you might have. So if you have pictures of some cases, you could throw those in there. Hey, look at this case. This is a great, bridge that I did. It's just like yours. It turned out, just like this. You could do that. And then you have that as a tool. That patient didn't have to come in. You didn't have to flip the room, use the wipes that are like gold right now. And you didn't have to potentially bring one more person in to have exposure. So really great. The patient didn't have to leave. off their couch, and if they no-showed, you didn't waste anybody's time. So great potential for follow-up. Lots of people are using it that way. The next is specialist consultation. So you saw that video of the Finger Lakes Dental Clinic that I showed you. Those guys are doing some really cool stuff, and there's lots of, particularly residency programs that are using models like that to reach people. And so here again, at the Eastman Institute, they're doing that program. So they're reaching out to people. If you can convince your specialist to open up, it'd be a great tool for specialists, and I know some are, but to get a group of specialists to agree can be difficult. But if you have, an innovator of a specialist, or you are in a group that has specialists in them, like, what better way to do it than be like, have a Zoom channel available, or some sort of video conference available where you could, have the patient get a consult while they're in the office, virtually, or you submit. Think about the way some specialists accept submitted data. A form that's filled out for the consultation, for the referral. That data, if they ask the right questions that's good enough for them, and they get the x-rays that they need, they can do an asynchronous visit and save the patient the consultation. They're this close to getting to that level. It's just getting that adoption can be hard. So if you're a specialist on your call, or you're in a group with specialty, I highly recommend that you could find some really good customer satisfaction and some efficiency gained out of that. Here again, here's someone who has an online form that they can fill out. If they just made sure they added questions about their signs and symptoms on there, they could potentially get enough to determine the next step, so that the patient can come in. Oh, looks like you just need a retreat. Here's our price. We'll see you on this date. These are the days we have available. So essentially, think of it beyond the referral. Think of it as the next step of a referral, electronic referral, which is using a teledentistry platform to a dentist to submit to a specialist, and the specialist communicate back with the patient, and figure out a good way to communicate amongst themselves. And also just great for follow-up care. So here's an example of a patient that sent me some information, and they wanted a follow-up, and I was using Weave at the time. I don't have Weave anymore. But hospitals use telehealth for follow-up care all the time. The next one's outreach that we'll get into here. So at Comtree, where I was the dental director for 5-6 years, the last year we left there, we were a pretty big operation, and we started the first teledentistry pilot in Missouri. That pilot was started in 2017. We saw over 1,200 patients. We went to nursing homes. We went to a nursing home where my grandma lived, two primary care offices, and 33 schools. We had 6 hygienists trained how to do it, 12 dentists trained how to do it, and it worked. It worked really well. We saw a lot of people, and we learned a lot. And it's adapted. And with COVID, I've heard that it's had to go on a hiatus a little bit because it's hard to get into places. But those places want to have the healthcare brought to their underserved patients, and that's what I think. Once we get a vaccine and we can get figured out what's safe and what's not safe, these programs are going to really blossom using teledentistry, the ones that have adopted it. But the program worked out really great. That's been my experience. It's also very similar to Dr. Glassman's virtual dental home model. And we have this van at Comtree. It's the Tooth Titan van, and it goes to places, and it's them unloading the equipment there. The next one's medical dental integration. I don't have pictures of this. We did try this with our Comtree pilot program, and so you can think of 4 different ways that you could do it. We did primary care integration with a hygienist, and so I'm just going to outline the concepts of these. But essentially, a hygienist could be co-located in a location, have their own operatory, have their own scheduled patients, or be scheduled as a stop in the primary care checkup. And then they're also just available in general for general health questions, to be like, hey, this patient, I was checking their mouth or looking in the throat, and I noticed a big red spot. They're available to look at it. A hygienist can kind of give some ideas. If an x-ray or picture needs taken, they can jump over and do that. So that's with a hygienist. There are practices out there, especially health centers, where they're using technology to let a nurse practitioner or a PA have like that smartphone application that had that retractor on there, or maybe they have a mouthwatch camera and they have Teledent, something like that, where they're able to have that available and send it to a dental colleague that's at another location. So that's happening in some health centers, I know for sure, but there's ways to partner. I've heard of some pediatric dentist offices that have even partnered with progressive pediatrician offices and have tried to partner with them in using telehealth. Another one's emergency room diversion. So a lot of emergency room systems might have people on call. Like we had a dentist at Comtree that was doing teledentistry, and she's like, man, when I was at the VA and I was at my residency program, I would have loved to have this, because if they could have just sent me the pano and the signs and symptoms and maybe a picture, I could review that and not have to get up at 2 a.m. and come in just for nothing, because a lot of times they'd have to go in just to see the patient within a period of time when they're on call, and they couldn't even do anything to the clinic open the next day. And so there's a lot of efficiency to gain there, and like quicker response time, and ability to maybe not send a patient out with an opiate when it's not necessary, because you could get a dental diagnosis quicker. So some real potential for emergency room adoption. And then secondly, in hospital care in general. So say a hospital could hire a hygienist that's just available amongst the departments. Maybe they have a cart or something, teledentistry cart, and they could go around and be available for the cardiology ward or the oncology ward or the ER, and just available in general as an oral health expert or resource that's able to send data to a dentist that's willing to take those patients on if they need follow-up care. I think there's some really, really good potential for that. The problem is just bringing those teams together. It's a long slog in this scenario in general, the medical dental integration, unless there's complete buy-in by the medical team and the complete buy-in by the dental team, and they really want to make it work. That's the only way to make it work, okay? And you've got to find your champions, and your champions have to do it, and they have to train up more champions, all right? Because what we saw when we did it was once you lost your champions, the pieces fall apart, okay? So that would be my recommendation for that. And then the last piece, again, patient monitoring. I kind of touched on this last time, just got a little short clip here. Just so you understand the concept of patient monitoring and how it might have potential. This is a medical example.
Mrs. Lee was recently discharged from the hospital. Her doctor ordered remote patient monitoring equipment to be delivered so Mrs. Lee can track her vitals at home. She's been on the program for about a week and a half when the remote monitoring nurse notices that Mrs. Lee gained 5 pounds in 2 days. She calls Mrs. Lee to ask about this weight gain and finds that Mrs. Lee has questions regarding the dosage of her prescribed diuretic medication. The nurse explains Mrs. Lee's medications and diet protocol. With her new understanding, Mrs. Lee's weight quickly returns to an acceptable range. Mrs. Lee's participation in the remote monitoring program has assisted her in avoiding a clinic visit and potential ED visit. Remote patient monitoring provides monitoring and support at home to help patients reach their healthcare goals.
So in the road ahead, that might seem far-fetched, but as technology gets cheaper, you're going to find ways that insurance companies or companies might incentivize people, just like they do with a Fitbit, to like have better brushing habits and things like that. Or maybe they have like in-home saliva tests or things like that. So there's lots of potential for those types of things in the future, and it's going to be a part of the future of dentistry in some way. Again, I do offer consulting services. Some stuff, if you're in Missouri, might qualify with the Department of Health with my contract with them to help people. So feel free to reach out to me or them. I can help them figure it out. And here's my contact information. If you'd like to reach out to me, my email's here. phone number. Feel free to call me or email me. And again, we got the Facebook group. With that, I think we pushed it right up to the limit. I hope I didn't rush it too much. If anybody's got questions, feel free to put them in the chat box.
Well, Dr. Burnett asked for your contact information again, which you've just provided. And then let's see, what was the name of the website manager software you use for your Zoom scheduling?
I use there's a free version of it. It's called Calendly. I'll try to type it in here. I think that should work for you. And so there's a free tier of that to try it at least. And at least during COVID, they had a free integration with Zoom. So if you had a Zoom account, it would automatically schedule the patient and send the patient a Zoom automatically. It might be a paid tier now. I'm not sure. And so, yeah, any of this stuff that I talked about, I don't make any money off of selling these things. I just, want to show you guys all the tools that you have available at your disposal. So feel free to, if you know of new things, I love to learn and explore new things. And when I don't have a solution, I like to figure my own out. So I'm, trying to create my own tool to communicate about it. And if anybody's interested in exploring what that's like, I love to have you try it out, no charge. I'd love to just get feedback on how that works. So if you're interested in that, let me know. But a lot of the stuff like the communication tool, you might not find out you need it until you're like really in the weeds of teledentistry, trying to figure out where the workflow gaps are. Cool. Anybody else have any questions? Great. And next week, what we're going to do on the second half of the workshop, guys, is Tiffany's going to go over data collection. So that data collection piece she's going to go over in a lot of detail, what kind of pictures she takes, what she does, tips and tricks on how to not have foggy mirrors and things like that. And then the last piece I'm going to talk about is like sustainability, planning your program, and what things you should consider, what things I've learned that didn't work, did work, and that kind of piece of it. So that's going to be the next half of our workshop. And in between now and next week, you have any questions, feel free to shoot me an email. Just put it in the chat box. Just so you know, my email is shorter than my website, so it's accessteledent.com. So my URL there is a little bit shorter. It's not a typo.
All right, well, great. I want to thank everybody for attending, and I want to thank Dr. Suter for the excellent presentation. Again, this will be available, a recording will be available. There's one other thing we need to share with you, and that is the code that you need for the CEUs, and that is Teledentistry. Not too surprising, Teledentistry is the code. CE Zoom.
Capitalize it, Gary?
Teledentistry.
Do you need to capitalize it at all?
No, it's I believe it's all lowercase.
Okay, cool.
All right, well, I think we're going to let you all go and hope that you have a fantastic weekend. The weather is supposed to be outstanding, so get out and enjoy it if you can. And thank you all very much.
Thanks, guys. Have a great one.
Bye-bye.
Recording is on.